Well, a big question mark still looms over what's to be expected when it comes to repealing and replacing Obamacare. Senate talks Tuesday made it clear the votes still aren't there for the GOP health bill, but Mitch McConnell is pushing full steam ahead. He says a draft of the bill will be released Thursday, and the CBO score could be expected next week. Senators believe there could be two drafts, one with an amendment from Ted Cruz and one without it. A vote on if a bill will proceed to debate is also expected next week. One America's John Hines caught up with Senator Rand Paul about the ongoing health care talks.
Hello, I'm here with Senator Rand Paul. We're talking about the health care bill, which has been rejuvenated, and of course the session has been extended a little bit. Senator, I just want to get your thoughts on where things stand right now.
I think the new bill looks a lot like the old bill, except for worse. We're getting rid of more of the tax cuts. In fact, we're keeping more Obamacare taxes. We're still keeping Obamacare regulations. And one of the worst things is they've added $70 billion to this insurance bailout super fund. Insurance companies make $15 billion a year. Why would the taxpayer have to give the insurance companies money? So I'm absolutely against this big bailout, of the insurance companies, and I don't see anything in there for conservatives. What they've done is they've given moderate Republicans who want to spend more taxpayer money, they're giving them more, you name it, they're spending money on it in this bill. So this just isn't a repeal. We need to repeal Obamacare. That's what we promised the people.
What about the Cruz-Lee amendment, which I guess would provide some flexibility with regards to these essential benefits? Thoughts on that?
I'm all for more freedom to buy what kind of insurance you want, and that's what the amendment does. I think the amendment also, though, is requiring more money to go into this big insurance bailout super fund. That I'm not for. So you shouldn't have to trade freedom for a subsidy. And that's kind of where we are now. They're saying, well, they might give us this freedom to buy more insurance, but only if we plus up and dump more money in this insurance bailout super fund. So I'm for the amendment, but I'm not for adding more money to this insurance fund, and that's kind of the sticking point right now. There's also some discussion that the Cruz amendment may have added to it price controls on how much you can charge for the insurance, and that's not really a free marketplace either.
What would it take for you to provide support for this bill, do you suppose?
What I've told the president, and we've talked many times on this, if it comes to an impasse and it can't get through, I want to be part of the solution. And part of the solution would be to divide the bill in two. Let's have one bill that does what we promised the voters, clean repeal. We just repeal as much of Obamacare as we can. Even if we don't get agreement on all of it, let's repeal as much of it we can, and it'll be a clean repeal bill, some portion of repeal. And then the big government spending that I object to, let's put that in another bill, and if big government Republicans want to pass that spending, they can work with Democrats. There's always an abundance of Democrats who want to spend money around here.
Well, that's an observation I've heard before, yes. Just one more question. Talk a little bit about potentially the timing when this might come up. Do you think it's a 50-50 chance of passage, 60-40? What are your thoughts?
I don't think this bill will pass. They're trying the traditional Washington way to pass a bill, and that's stuff more goodies in it. So if you're a senator from a certain state, what do you want? How much money can I give your state to get you to vote for this bill? That's what they're doing now. But the other way to do it would be to say, hey, why don't we narrow the focus and get to what we can agree on? Susan Collins and I are not in the same place, but I think there is a certain portion of repeal that we could agree to. I want 100% repeal. Let's say somebody else wants 50% repeal. We get 75% repeal. But you have to realize this bill is only going to repeal about 50% of the Obamacare taxes. So last year, every Republican that was elected to Congress was for 100% repeal of the Obamacare taxes. We're now down to 50% repeal of Obamacare taxes. So really, these people just aren't keeping their word. They promised to repeal Obamacare, and now we're just cutting a little bit around the margins. And for the first time, Republicans will be on record as saying it's the federal government's responsibility to buy health insurance. And I just don't think that's a responsibility under the Constitution for the federal government.
Thanks, well, there you have it, the latest developments in health care with Dr. Rand Paul. Thank you, sir.